Hi, everyone. Welcome back to the Mind Movement Health podcast. I'm your host, Kate Boyle. And today on the podcast, we have a very special guest, Stephanie Nelson. Welcome to the podcast.
Hi, thanks so much for having me.
Well, I'm excited to have you on. We love talking about women's health, nervous system regulation, but we've never dived into somatics before and somatic healing. So, something new this week on the podcast.
Great. Well, I'm so happy to be the one to guide you and the listeners into somatics.
But before we do, can you please do a short little introduction of who you are and what you do?
Yeah, so a little intro. I got into this work because I needed it for myself. I struggled with many different diagnoses from chronic pain diagnoses, gut issues, anxiety, ADHD, and for decades, I was just playing whack-a-mole with my symptoms. I was tackling one issue and then another issue, and it was like an energy thing and an anxiety thing and a focus thing and a mood thing and depression thing and da 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 da. And eventually I found the nervous system and all of the light bulbs went off like, oh, the nervous system, because it's the master coordinator of all systems, that it is at the root of physical health, mental health, gut health, hormonal health, sleep health, mood, relationship health, all of the things that's so intricately tied to the nervous system. So it's been this real solid foundation for me, whether it's in the entrepreneurial space or in my relationships or grief healing journey when my father passed away very suddenly. Like, no matter the stressful life experience, I have this foundation of support from the nervous system and from somatics, so that when I face inevitable stressors, that I feel capable and I can rise to the challenge rather than spiraling into these old familiar patterns of whatever the label is, whatever the diagnosis is. But there's a new choice point for me moving forward, that I get to show up how I want to show up and be really proud of the choices that I'm making and the actions that I'm taking.
Hmm. I love that. And it sounds amazing. And I'm sure there's people listening in going, I want to be able to do that too. So, where should we start with this conversation?
Hmm, where should we start? I'm feeling pulled to talk about and share around so many of the things we're like moving away from. There's the diagnosis that we've been given. For example, I was 12 years old and had a diagnosis of arthritis, bursitis, and tendonitis in both of my hips. And my doctor condemned me to a life of pain medication until inevitable hip replacement surgery or I'd be in a wheelchair. She said by the age of 30. So sometimes we experience things and we're struggling through things, and the people that we go to for help are putting these limitations on us. So whatever those things are for people, that the bad thing, and I'm doing air quotes for those people listening, the bad thing that we're moving away from a nervous system perspective, is adaptive. If for some reason in the past you did it for the sake of your safety and survival, and so now it's become so practiced that we just do it on autopilot. We don't even think about we're doing it. It's just automated and easy, and just our default patterns. And so if we layer in that lens of like, oh, it's one, adaptive, and two, it's practiced, we get to renegotiate what that actually means in terms of, one, we can heal it, right? Because it's a thing that we've been practicing, so we can practice something else. And two, the amount of compassion that we bring in to like, oh, this anxiety that I've been struggling with, like, I hate that I'm so anxious. I hate how I behave in relationships, or I hate how I behave because of the anxiety or the chronic pain, the tension. Like, oh, it limits my ability to work out. It limits my ability to play with my kids. Like, whatever the thing is that we're like, I just hate this about myself. That this reframe adaptive survival strategy gives us a new lens for us to get deeper into, okay, well, why? Like, how are we doing this? How is the nervous system doing this? So that we can, one, complete the cycle and like let it be done so that we can open up to something else. And then two, we get to be in practice of, well, who do I want to be? And we get to practice those things not under pressure. It's not when we're facing, like, we get that email, or, maybe we're laid off from a job, or whatever the stressor is. Not practicing only in times of pressure, stress, or challenge, but that we're practicing like first thing in the morning, or as we transition from work into home life, that we have these like 2-minute, 3-minute, 5-minute practices of recalibrating ourselves so that we show up better under pressure. And somatics is the vehicle we do that. I think, if you look at somatics online, it's like, ooh, body. Somatics is body based, because the alternative in the mental health field is talk. And we're understanding now talk therapy is not great for people who are stressed out. We can dive into that if we want. But somatics is body-based, but it's more than just the mechanical body. It's the physical body, the sensations, but also the emotional body, how we feel about things, the endocrine system, the immune system, the gut, right? Our gut instincts. What are our impulses? So we get to bring in all of this body wisdom, all of this beautiful color and experience that is authentically you. And it shapes how we show up, and it shapes how we want to show up.
And if somebody is interested in somatics, is it best to visit someone first and, like go to a class sort of thing? Or is it better to just try and do a little bit at home? Or where should people navigate that sort of area?
I fully believe that everything is better when we do it with people. And from a nervous system perspective, the nervous system would agree. So it's really interesting. I feel like most people are familiar with fight flight as a survival strategy, right? Everyone's very fight or flight, fight or flight. Yes. And we have many other survival strategies. Fight or flight, this mobilizing, they're actually different strategies, but we lump them together, very different, but they're both a mobilizing strategy. And then another one that's very common is a shutdown strategy, where people go flat and numb and disconnected, which was very common for me. I would get out of the shower, sit at the edge of my bed, and 20 minutes would go by. I'm like, what am I still doing here? So we have this shutdown response as an adaptive survival strategy, but the one that most people miss is actually our first line of defense against stressors, pressures, challenges, threats, and that's social engagement. This is the first place we go. And the more that we can develop relationships where we feel safe enough to connect with other people, that is the most healing thing for the nervous system. And for many people who were traumatized in relationships to one another, and sometimes the trauma doesn't look so big that it's small, we sort of like rationalize it away. And I see this all the time nowadays with parents on their screens instead of watching and paying attention to the child. That is traumatizing for a child's nervous system, to constantly feel like they're not worthy of attention and they're competing for this screen attention from you as a caregiver. So sometimes the traumas don't look so big, but for growing up, if we do experience trauma in relationship to other people, it's really hard to feel safe in relationships. And so there are ways that we can feel and build that level of safety through things like spending time in nature, right? Barefoot grounding, listening to bird song, looking away at something really far, um, or even in relationships with pets. So there's lots of other ways that we can have this social engagement system turned back on. But no, I really, really recommend people find a practitioner that they feel comfortable with, that they feel like sees them and encourages them and supports them. And because what can be so tricky about somatics is there's so many options. And so finding the things that work for you specifically is a journey. And it's hard to know what you don't know, right? Like you could try on the practice, but you're like, I don't know what I'm supposed to feel afterwards. Like, I think I feel calm, but oftentimes calm is the shutdown response that I just named earlier. And so there is so much nuance to this. So definitely recommend finding a practitioner to get started with.
And as far as somatics go, here in Australia, I think it's emerging, like it's obviously been around for a very long time, but it's also one of those kind of fields that a lot of people haven't heard of before. And it is starting to kind of come into the spotlight along with nervous system regulation and things like breath work. Everybody's already heard of meditation and that. But is there a big difference with regulating your nervous system through breath work or regulating your nervous system through somatics, or is it just more of an individual choice?
Yeah. Well, breathing techniques, breathing practices is a type of somatic practice if it's done correctly. So, what can so often happen, and we saw this big wave of somatic um, releases or somatic practices in the 60s and 70s, were more of this like cathartic release where we're just sort of blowing past our own body's wisdom and just keep pushing. And this is one of the reasons why exercise can be a somatic practice, but it could also be something that we use to distract ourselves or numb ourselves or not listen to our bodies. So the nuance there is really, really important, which is again why working with practitioners is a really good idea. But breathing practices are types of somatic practice. So actually, I have a membership where the foundational somatic practices and foundational breath techniques are free inside of this entry level space. And then we deepen into different types of practices that are, intended for setting boundaries or taking up space and feeling more confident or restoring your energy. But breathing techniques, yeah, are somatic practices, but they're also different. So we have breath practices that can increase our energy and ones that can bring on the parasympathetic nervous system to sort of down regulate the nervous system and bring about a sense of ease and calm and peace. So there are different breath practices for the sake of different things, different intentions, different outcomes. However, everybody is so different. So something that may be promoted as a calming breath might really activate and trigger somebody else. For example, there's a somatic practice, it's called the butterfly hug. And it's, for those listening, I've got my hands on my chest and my thumbs are interlaced, and one hand taps and then the other hand taps. And this is meant to be a calming practice to stimulate the parasympathetic nervous system. It irritates the hell out of me. I hate it, right? So, not every breath or somatic practice, even though it's meant to do something, is going to do that for everybody. And that's honestly great information if you're like, I hated that, or that did not help me feel X, Y, and Z. It's really good information.
Mm. And I guess it's a bit trial by error, isn't it? Like you said, you don't know until you try it, and then people do get frustrated when things don't work the first time or even the
Mm.
second time, and then they have to try something else or go to somebody else too. So I think that's sometimes a barrier that people need to work through as well.
I'm so grateful that you're bringing that up, Kate. That's a huge point because we do get frustrated really early, easily, like, and especially with Amazon and like same day deliveries, like we're so instantaneous. We want instant results. However, depending on how old you are and how long you've been doing a thing, right? If I've been practicing feeling really impatient in my life. Like I'm working on something and I just want it done now. Or, I have chronic pain in my hip and it's been there for 10 years or whatever. That is an experience that's been going on a very long time. You've been practicing that, maybe not consciously or intentionally, but your system is organizing in this way for so long, and then to be like, I did it once and it didn't solve all my problems, is it's silly, right? It's really silly. So in one of the lineages of somatics that I'm really practiced in, the Strozzi lineage of somatics, they say that it's 300 repetitions for embodiment, right? So 300 times to practice something, to embody that thing. So if you're trying to do a somatic practice to help you embody calm or peace, like when you want to shut your brain off instead of running the to-do list all the time, 300 reps, okay? 3,000 repetitions under pressure.
Which you would assume is most people that's looking into somatics.
Yeah. And, like, let's say you're trying to chill and, oh, I'm getting so much better at being able to do a puzzle with my kid and, like, not check my phone, right? Now pressure comes on and it's a whole different situation, right? So, yeah, 300 reps for embodiment, 3,000 for embodiment under pressure. So important to stay with the practice over time. And that's why I love somatics. Like the practices I share in my membership resourced are like 5 minutes long, right? And eventually the idea is you don't need the video. You can just do the thing. You don't need me anymore. That these practices can take a minute or 2 minutes. So you can do it 2, 3, 4, 5 times a day.
That's a good point to highlight because a lot of people think when they start whatever it is, maybe it's going to a somatic class or it's meditation, that they need to put an hour aside every time that they do something like this. And then again, that's a big barrier because they don't have an hour to dedicate to that. Like they've got to get off and do other things and go to work and pick up the kids. So knowing that you could do it just in a couple of minutes and spread it throughout the day, I think is really empowering for people too.
Absolutely. Absolutely. And I have one teacher that always says, like, doing something for 2 minutes every day is better than doing one thing once a week for an hour, right? Even though 2 minutes every day is less time, we're getting the reps in. So she's not even one of the very different lineage of training, but still consistent across the board. What matters more is this reps to bring us back, right? Like remind our nervous system over and over and over again, oh, it's safe enough here where I am that I can open up into creative possibilities for how I want to move through the world. But it's like, oh, just let's bring it back, bring it back, bring it back.
And for people that are listening in that are curious, they're thinking, well, how do I know if my nervous system is dysregulated? How do I know if I need this? Or can I keep just doing what I'm doing and not worry about it? What should they be kind of looking out for symptom wise or checking in with?
Great question. I would say every single person on the planet has some level of stress and trauma that they need to work through, or they can work through. It's a choice, right? It really is a choice. You can 100% keep going on with your life and never worry about the nervous system again. The things I would pay attention to, if you have any sleep irregularities, like if you have a hard time falling asleep, or if you wake up at 3 o'clock in the morning, or if you're waking up and you're feeling tired still, even though you slept for 8 hours, nervous system thing to look at. Any gut issue, any skin issue, any mental health disorder. So if you've got a diagnosis of anxiety or depression or OCD or bipolar, um, nervous system, look at the nervous system, acne, hormonal issues, chronic pain, any autoimmune condition. I mean, you can see like literally ADHD is big. Is another diagnosis to pay attention to. Um, I mean, really any diagnosis or anything that you're, if it's fertility things or sex drive things, nervous system. Nervous system has an impact. And this is an important thing too, is not what, and this is maybe, there's probably better ways of saying this, but it's just going to come out of my mouth right now. But not one thing makes you sick or out of balance, right? Not one thing. And not one thing is going to solve it either. It's really about finding the right recipe for your health and harmony of you as an entire, complete, complex system. So the nervous system is going to be a big part of that because, again, it's the master coordinator of all of the systems. And there's going to be other things at play too, right? So if you're mineral deficient, that's going to impact, right? Like, for example, there's a really strong correlation between joint hypermobility and anxiety, right? So there's so much at play here. So it's really important to not put all of your eggs in one basket, I guess, so to speak. And it's like finding the right combination of things that's going to support you in feeling your best. But the nervous system is 100% a piece of every puzzle.
Mm. Well, that's what I always say with my clients, working with them in the studio. I work with a lot of clients that come in with chronic pain, and physically we can rehab the injury, but then I'll often say there's another part of the injury here, and whether or not that's an emotional side, it's a trauma side, do you know what I mean? There are other pieces, stress, and I'm like, and this is another section that you're going to need to work on. I may be able to improve the pain by 50%, but the other 50% is coming from a combination of other things. And I think sometimes that's hard for people to kind of link that back, like the great book, The Body Holds a Score, that we do hold trauma in our body. It could be emotional trauma or physical trauma, whatever trauma it is, in different ways. And I think sometimes for people, when they are in that midst of pain, they do just think it's some type of, if I do an exercise, it'll fix it and it'll be gone. And it doesn't always happen that way.
Right. Yeah. Well said.
And then when it comes to looking into, say, inflammation is a big topic right now. Lots of people are saying, I've been told I'm inflamed. Do I reduce inflammation? Should I be going on an anti-inflammatory diet? Does somatics and nervous system health come back to this too, and helping with inflammation as well?
Yeah. Inflammation is part of our immune response. And your immune response is a protective system, right? Your skin, your gut, those are the outsides of your body, and they're protecting you from the outside world. And when we have inflammation as an immune response, this is why autoimmune conditions are very connected to the nervous system, but the immune system, the endocrine system, so your hormones, and the nervous system are very intricately connected. And this is the work of Dr. Candace Pert, in psychoneuroimmunology. And she eventually wanted to rename it as psychoneuroendocrine immunology. But everyone was like, it's already too long. We can't add another word. But those three pieces are really, really connected. The hormones, the immune system, and the nervous system, for sure.
And when it comes to just everyday somatic practices or nervous system practices that people can do, what are some simple ones that people can start with? Or if they do dive into it further and then they want to support that practice a little bit more, what can they do at home?
I feel like the lowest hanging fruit is taking care of your basic survival needs. So this is often not even something that's discussed in the somatic space, but because the nervous system is all about safety and survival of self and species, then all of the pieces in your life that are contributing to your safety and survival, like your food, your sleep, shelter is a basic survival need, relationships, touch, hydration, these are all basic survival needs. So if we can, one, do the thing that is good for us in these spheres. So, making sure that we're sleeping really well. And that's a whole, there's like 80 things inside of that, right? Or eating well. And again, there's so much information out there about and misinformation and conflicting information. But at the end of the day, like if we get really simple and being like, okay, I know sleep is really important for me. So what are two things that I can do every day to make sure that I'm resting well? And then celebrating those choices when you make them is really helpful for your nervous system. So you might have a friend or two that you're like, let's start like taking care of our sleep. There's another friend who doesn't sleep as well, very well. And so you guys have a little text and maybe you pick an emoji, like the parrot emoji or something. And it's like, oh, I did this thing. Maybe that's, okay, I'm not going to watch any screens for an hour before bed. And maybe I'm going to replace, all of my like flickering LED lights with full spectrum lights in the house, right? So like picking your things and then celebrating yourself doing them for those basic survival needs, I think is a really low hanging fruit, because I feel like most people have an awareness of a few sleep promoting things or food promoting things or hydration promoting things. Like maybe I should have a glass of water before my first cup of coffee, right? Like that is awesome for your nervous system. So low-hanging fruit. Another low-hanging fruit is vagus nerve stimulation.
Please explain. I know a few different ones, but
okay. There's a lot, as I named earlier. There's so many practices, right? And even in the basic survival needs, like just inside of sleep, I can think of 80. I could probably list off 80. I'm sure there's a lot more. So there's lots of different vagus nerve stimulators. There's even devices that you can buy, like a pulsetto, and there's a few other brands. I mean, I don't think that's even necessary to invest in a device, because one of the things that you can do to stimulate your vagus nerve is hum. And so this is not only a vagus nerve stimulation, but it's also a really powerful breath practice. You were talking about breath work earlier. This is a great one to stimulate the vagus nerve. Ear massage is another great way. Okay, great. I'm going to share that on my Instagram this week. I just filmed it before we met, so stay tuned for that. Because your vagus nerve, so for those people who, I'm sure you've talked about the vagus nerve before.
Yeah, we have on the podcast.
Yeah, so just a little brief for those who maybe didn't listen to that episode or need a refresher. Your vagus nerve is your wandering nerve, so vagus wanderer, and it wanders from your brainstem to every organ in your body. And it is the primary contributor to the parasympathetic nervous system. So both the shutdown or like intimacy states or rest states, but also the social engagement states. So the states that we want to access for creativity, to be in like a flow state, or to be intimate with people and to be able to rest safely in the arms of another. So that's the vagus nerve. Humming, as I named, ear massage is another great one. Yeah.
Gargling, I know that you can, that's meant to help stimulate as well. And then we had a guest one that was talking about the cold water immersion, but just for the face, because of the sheer amount of nerves and that on the face.
Yeah, that is thank you for bringing that up. That's such a big one. I guilty of doing cold plunge for years. This was like 2017, 2018, 2019. I don't do cold plunge anymore because you don't need that intense to stimulate the vagus nerve. And that's what we're doing in cold plunge is we're stimulating the vagus nerve. You can just splash cold water on your face. You don't even have to dump your face in an ice bath. You could splash in cold water. You could just take an ice cube and place that on your face. And what is really interesting is you have the vagus nerve, which is, as I named, really important for nervous system health and harmony. But it's actually part of a larger complex. So there's 5 cranial nerves required for social engagement. So it's cranial nerve 5, 7, 9, 10, and 11. So cranial nerve 10 is the vagus nerve, but cranial nerves 5 and 7 are the facial nerve and the trigeminal nerve. So a lot on the face, which is why this cold splashing on the face works so well, is not necessarily just for the vagus, but because the vagus and those 4 other cranial nerves are so interconnected.
Hmm. Well, I always thought that one was quite good because I've been doing my breathwork course, and as part of that, we have done a few cold plunges. I've really struggled with the cold plunges. Like, I thought I would be okay, but I tell you, the breath gets knocked out of me, and I know part of it is harnessing the breath. That's a whole part of it. Goodness, even just recover, my body prefers the saunas and the heat
Yes.
to the cold plunge. Like being a woman, heat all the way.
Yep. Yeah. And I'm so grateful you're bringing that up, especially the relationship to heat. And for women, you're so right. Men have different bodies and nervous systems and hormones than women do. And most of the research is done on men. So we don't have really good research on women for really anything. Um, and so I think cold is better for men. I think it can be utilized when we're in our ovulation cycles, more so than we're in our luteal or when we're menstruating or bleeding. So different times. But the whole point, like, of this particular, and you named it so well, is like, oh, the breath gets caught. So initially we have that sympathetic drive. And then the idea is we go up high in sympathetic and then it balances into the parasympathetic. But for so many people, our stress responses are, we get practiced in stopping the stress response from completing. And so we're not actually able to move through that cycle. And that's, so again, we need to practice moving through the cycle, not under pressure of the cold, of the extreme cold, before like layering on. But I find for a lot of women, it does not feel great.
No. And if a lot of people don't have that prior knowledge, they just get told you should be doing cold plunges. And so then they just keep doing cold plunges. I'll just keep persisting and I'll just keep doing it every day and that will make it better. But unless, like you said, you're practicing and harnessing that control of your nervous system outside of that stress, it's going to be very difficult to progress when you've got that extra stress added onto it. So I think that's a really good point to build up, that your own practice in a relaxed setting when your body is relaxed is just as important, if not more important, than practicing when you're under stress.
More important for sure. Yeah.
Mm. And I just wanted to highlight, you brought up before about normal sort of therapy practices, or what we say normal, the ones that people know about, like talk therapy and going to see a psychologist and things like that. Is somatic work something that you can do alongside that? Or I know a lot of people that see therapists that are like, well, I've got that covered because I'm seeing a therapist, so I don't need to do anything else. So is it something we do alongside or instead of, or is it something you talk to your therapist about?
Yeah. Great question. And I'll name something that Dr. Bessel van der Kolk said. I got to see him twice this year at 2 different learning experiences. And he wrote, "The body keeps the score," as you named earlier. And he said, and actually both of these experiences, that, because he is a psychiatrist by trade, so talk therapy, right? Talk therapy for the beginning of his career. And most people, the therapist will ask, okay, well, when should I introduce somatics to my patients or my clients? And he says, you've got the question wrong. You don't wonder when you bring in somatics. The question is, when do you bring in talk therapy? You start with somatics, you bring in talk therapy, all the while still doing somatics. Because when our nervous systems are overwhelmed with stress, the prefrontal cortex, the medial prefrontal cortex specifically, the part of the brain that's responsible for thinking and logic and reason, is offline. And so for people who are seeing therapists, your nervous system has to be in a place of feeling safe enough to be able to communicate through words. And so much of what's needed for change to happen is the body feeling safe. And we can't think our way to safety. We can't talk our way to safety. So they can definitely be done side by side. If you are seeing a therapist and not seeing a somatic practitioner, get yourself a somatic practitioner ASAP. If you feel like you should see a therapist and talk through some things, start with somatics first, and then layer in talk therapy when your nervous system feels ready.
And do, say, psychologists or talk therapists, do they do study in somatics throughout their courses, or is it usually something they don't do, or it's something extra they have to look into?
So no somatics in the US is offered in mental health programs. To become a therapist or a psychotherapist or a psychiatrist, no somatics is offered. Many of the therapists nowadays are starting to dabble, and this is one of the I was in an intensive, and there was 175 of us, and most of the people there were talk therapists. I thought as a somatic intensive, somatic practitioner intensive, that it was going to be all somatic practitioners. There were no somatic practitioners there. There was like 9 of us. They were all talk therapists being like, talk therapy is not working. And it was so interesting. The first module inside of that training experience was from Bessel van der Kolk, and he just tore apart talk therapy for like 2.5 hours. And I knew everyone around me was a talk therapist. And so afterwards, I'm like, how is that landing for you? And most people, instead of feeling angry about it, felt so validated because they're like, talk therapy is not working. And that's how somatics in the Western context, because really somatics is an ancient practice, and many indigenous tribes have been practicing somatics for thousands of years. But the word somatics and how we're using it alongside the nervous system in this westernized scientific way is new in terms of so many of the people who created their methodologies of somatics, like Dr. Peter Levine in somatic experiencing, or sensory motor psychotherapy from Pat Ogden, or Ron Kurtz and Hakomi, all of these different people. There's the Feldenkrais, but so many of them started with talk therapy and realized it wasn't working. Another great example is Dr. David Berceli in tension and trauma release exercises. Talk therapy is not working. What do we do now? Oh, it's body-based, right? Because stress is physiological, right? You don't decide to be stressed. You don't wake up in the morning and you're like, I'm going to be so irritated about everything. I'm going to be so overwhelmed today. Everything that happens to me, I'm going to hate, be angry at, resist, feel annoyed by. I'm going to be so impatient. No, you don't decide to do that. It's a physiological response, and it's instinctual. So that's where we have to go back to the body, back to our physiology to help unwind some of these patterns.
And I want to ask, because I can see on your hands, for anyone who can't see the video here, Stephanie has some lovely jewellery. Do they have meaning or just because you like them? Because I haven't seen anything really like that before.
Yeah, this is actually, I was at the Boston Trauma Conference. It's put on by Dr. Bessel van der Kolk. So, wow, he's coming up a lot today. Yes, so this one on my left hand is the dream catcher.
That's cool.
Yeah, and as a Pisces sun, dreams and dreaming and like dreaming into possibilities and future visioning of what could be is really near and dear to my heart. And then this one is a lantern, and it's got emeralds inside of it too. But this lantern is like to me fiery and like guiding the way, like lighting the way. I also have no fire in my chart at all, so I was like, yeah, I'll take the fire, the lantern to light my way.
Well, they're beautiful anyway. They look lovely. When you're speaking, you can just see glimpses of them. So it looks really nice.
Thank you.
Now, before we wrap up, I always ask my guests that if there's one piece of advice or a takeaway from today's episode that our listeners could instigate straight away after the episode, after listening in, what would it be?
Hmm. I feel like there have been so many already that have been named. So I might just use this opportunity to name a few, summarize, and see if there's anything else that wants to come in. But the first is find a somatic practitioner because we don't get stressed and traumatized alone and we don't heal alone either. So that would be a takeaway, like go find a somatic practitioner in your area or online. You can come hang out with me on Resource. I have tons of somatic practices that are, again, like 5 to 10 minutes. Things for your sleep, things for hydration and food, the basic survival needs, like clearing clutter in your home is not just aesthetic. It's not just control oriented. We are literally biologically hardwired to not like clutter, which is so interesting. Because evolutionarily speaking, if we were in a space and there was a lot around us, that we wouldn't be able to see threats on the other side of all of the things cluttering our field. Vagus nerve stimulation, so the cold water, the ear massage, humming, gargling. I'll add one more, and that is a really simple thing that you can do is as you're on a screen, every so often, look away from your screen and look at something really far away. Let the eyes go really wide. The eyes are part of our brain. It's actually part of our nervous system living on the outside. But when we're stressed, we focus in very intently and we're tracking the threat, right? We're tracking the predator. And now we've gotten so used to tracking on a screen, right? Writing emails, watching television, reading on Kindles, whatever it is. Like we're tracking, we're focused, we're narrow, and we're tracking. And that is sending signals of danger to the nervous system that there's a threat that we're tracking. So if you're on a screen for more than an hour a day, I would, yeah, so
It's a lot of full-time workers, yes.
Yeah. That is a really simple practice that can take you 10 seconds to look away from your screen. Ideally, like you can look in your room, and sometimes a good trick is to try and look at two corners of the room at one time, but not trying too hard, like not straining your eyes to do this, but letting the eyes get soft, letting the eyes go wide, and just sort of gazing, widening out to two corners of the room. Another option is to look out of a window. So I have a window in front of me to look out, and there's a few different trees. If you can look out a window and look far away, or go outside and look at the distance and just let the eyes soften, that's a really helpful way to keep reminding your nervous system, like, oh, there's no stressor or threat that I've got to track. And your nervous system can soften.
Just, as you're saying all this, I'm like, our lifestyles and society are just built in opposition to everything that we need to do to support our nervous system. So many people's jobs are sitting at screens at 8 hours a day in the same position. Like you said, we're in houses and we're not outdoors as much. And because we're stressed about work and cost of living, we're not going out and socializing with other people because we don't want to spend money. Or here in Australia, petrol has gone up, so then people aren't driving. All of these things are so counterintuitive to our nervous system, yet our society has built them in that a lot of people would feel like they can't escape from it. It's just so sad.
Yeah, it really is. And it's one of my greatest and highest intentions of Resourced is that it's the membership that I offer, is that we're resourcing our nervous systems not to keep living inside of systems that are stressful and traumatizing, as you're naming, right? But to be able to live life and have the energy and capacity to change the system.
Well, let's hope that all of us can start to make those changes to move in that direction because, as you said, it's only going to be better for our nervous system, for our overall health, our relationships with others, and so much more. And I'll link your membership and everything up in the show notes too, so listeners can head across there because I think anything that's in that step in that right direction is only going to be beneficial for us as well. But thank you so much for coming on the podcast today. Where can our listeners reach out and connect with you?
Yeah, you can find me at The Stress Healers. So on Instagram at The Stress Healers, and my website is thestressshealers.com. Substack is the same at The Stress Healers.
Amazing. Well, thanks for sharing your wisdom and being an amazing guest on the podcast.
Thanks so much for having me, and lovely to connect.